Onur. Okay, Dr.
Hello, how
Onur
are you?
Yaman will talk about lumbar disc herniation conservative management. Please,
Oh,
Dr. Yaman.
Salman has told everything. There is nothing to say. Thank you so much. So I have to share my screen.
Yes.
Onur, you can try out. Good.
So it will be a summary after Salman. So we're going to answer which conservative treatments are effective. Is it a treatment or just tapering of pain until it prolapses is resolved? And is there any evidence that disc herniation can be reduced by physical therapy? So we have reviewed 336 papers. So 85% of the low back pain, the acute back pain.
Onur, can you make the whole screen?
Yeah. Let me do it. Is it fine now?
Yes,
Yes.
it's okay, fine.
Okay. So 85% of these acute back pain can be treated by non-operative treatments, and none of them are physiotherapy, traditional conservative treatments, pharmacotherapy, and active movements. For the physical therapy, we can do exercise, application of heat, cryotherapy, ultrasound or laser, and also the TENS treatments. I have a problem with my screen here. Sorry for that.
It's okay. We see that.
Okay. For the studies of acute low back pain, this is a study from Turkey. They have compared the laser therapy and an ultrasound and also the lumbar exercises, and they say that both treatments are effective. And the laser therapy and the ultrasounds had longer effect on the same parameters. Another study about the bed rest, Salman has told about it, so I pass this part. So pharmacotherapy, again, the anti-inflammatory medications and also the opioids are the choices. There's a study from Valat. They have compared diclofenac, ibuprofen, and meloxicam. They say that both of them are effective of acute back pain, but meloxicam is much better tolerated about low back pain. Non-steroids might be more effective on acute stage of lumbar disc herniations. So epidural steroid injection is another method, but it doesn't work more than 2 weeks. So is it a treatment or just tapering of pain until prolapse is resolved? There are some studies, and they say that lumbar discectomy is the standard surgical procedure for the patients. And in the modern times, less invasive surgical techniques are available than the previous one. Spontaneous regression is a choice. Some disc herniations can be resolved in time with conservative treatments. So a study from Ergenoxokis, it says that percutaneous disc decompression works in the patients that are young and the symptoms has developed for a short time. It may be a choice for the acute disc herniation cases. And also another choice is a plasma disc decompression. And it also works in the patients that are younger, had a short period of radiculopathy, male gender, and the patient have low body mass indexes. And another study is that it says that surgical treatment doesn't have benefit over the conservative treatments in a short time follow-up. The study from Zhang, it says that the giant disc herniations can be dissolved in time. The rate is 66%. And a study from Ma, it says that the lumbar disc herniations, the giant disc herniations, can be dissolved in time. And the most important part here is the bullseye sign. It says that if the vascular structures go around the disc and the ring enhancements around the disc herniations that's seen on MRI, it is a predictor that the disc can be dissolved easily in time. So the statements that we have give in the conservative treatment of disc herniations were bed rest can be recommended in patients that have acute back pain. Non-steroid treatment is an effective way to dissolve the symptoms of low back pain. And 66% of the disc herniations can be reabsorbed in time. So conservative treatment can be a treatment method for the patients that have no deficits. So these are the things that I want to say. Thank you so much.
Okay, thank you, Dr. Yaman. We can, okay, we're open for the discussion and to the presentation of Dr. Yaman.
So it was a summary of exactly of Salman. For the acute back pain, you can use non-steroids. The summary is that. Opiate doesn't have to use in that period. Bed rest can be recommended for a short time, at least 2 days. Then after that, the patient has to come back to the active life. And another thing that we can say, after the acute stage, the patient has to start the exercise.